Hey guys, in the last video we looked at improving your hamstring stretch and trying to make sure that that's more mechanically appropriate to reduce your risk of injury and just to get a better overall stretch. In this video we're going to look at improving your piriformis stretch so it's also more mechanically appropriate and you get a better stretch. So we got Danielle here again, and she's sitting on a stool where her hips are slightly higher than her knees. In this position, what she's going to do is she's going to go ahead and cross her right ankle over her left thigh, so we're stretching the right piriformis here. Now what you'll see a lot of people doing when they get in this stretch is that they tend to try and push down on their knee to accentuate the stretch. So if somebody had a piriformis that had no tightness at all and you're looking at the muscle length, the knee would come parallel right with the floor there. So you can see that Danielle has some slight tightness in her right piriformis. So the first thing I'd ask her to do is to slide her foot a little bit over so we have a straight angle down the side of her hip here on the right side. And then just like in the last video, we're trying to line up the pelvis in 3 dimensions. So we're making sure that she's not way over on her left butt cheek. So Danielle's going to make sure that she puts her weight down on her right butt cheek a little bit so she can feel both sits bones on the surface that she's on. And also, because this right leg is going to come up, the tendency for people is to drop the right hip back. So it tends to roll back, which will also roll your spine back. So if Danielle puts her hands on her hips there, on the top of her hip crest, then she can direct this stretch. And much like the hamstring stretch, because of the attachment or the origin of the piriformis, we're going to have a lot of sacrum involvement here. So when she is stretching here, she wants to make sure that she's diving her pubic bones down in the front again, so she's leading the stretch from there. If you're really tight, you might not move much in this position. So again, she's going to try to lean forward from the pubic bones, keeping her spine up. And notice there's not much movement there. Do you feel a stretch on the side of your hip there? Perfect. And you know, if you're really tight, you might barely move. Even just putting your leg in this position and then squaring your pelvis up in three planes of motion might be enough so you don't even have to move, and then you come back out of the stretch. I am a fan of active ballistic stretching, and what I mean by that is that you're not holding static stretches for long periods of time. You're making sure that your nervous system responds well to it, and I have found that clients respond better to active stretching versus static stretching. So I hope that's helpful. Keep checking back. We're going to do more stretching videos and looking at how you can improve your overall health. Thanks a lot, guys. Now here's one of the things that we don't talk about a lot is the pelvis is neglected a lot in physical therapy and rehab in general. So we want to make sure that Danielle's pelvis is aligned well. So when she's sitting on the edge of this surface, notice that she has her hips above her knees. So it's going to give her a little more leverage to be able to fold forward with her pelvis instead of